Hello, my name's Edgar. I'm a Newman nursing student. I'm here to put a urinary catheter in due to the doctor's orders, which I double checked. All right, and can I have your first and last name? Sue Quinn. Awesome. And your date of birth is 7/21/1951. Awesome. And your room number is 2361. That's good. Okay, do you have any allergies I'm going to be aware of? Levofloxacin and strawberries. Okay. Well, are you allergic to shellfish, iodine, or latex? No? Okay, awesome. Okay. All right, I'm just going to get my stuff ready. Okay, I'm gonna go ahead and raise your bed, okay? All right, a little lower, too high. All right, that's perfect. All right, I'm gonna go ahead and lower this. Okay. Okay, awesome. Okay, so I'm gonna go ahead and pull this down, okay? So I'm gonna go ahead and pull this down. Privacy, at least a little bit. I know that this is gonna be gonna have this pulled down, so I'm gonna go ahead and pull this up, okay? Expose you just a little bit here so I can get to where I need to be. Put your hand there for me. All right. So there's already a chucks in here. I would bring another chucks and put that under her, but there's one in there now. Okay, I'm gonna go ahead and put your legs right here, like a frog position here. And then I'm gonna go ahead and put this one here. Okay, awesome. That's perfect. All right, I'm gonna go ahead and put a biohazard bag where I can reach it. Okay, we can go ahead and put it right here. I think that will be all right. Okay, so now I'm gonna go ahead and get ready to put everything in. Okay. All right. Unopened Foley tray. Unopened, brand new, not expired. And I also have extra latex gloves, sterile gloves. Okay, awesome. Okay, so now I believe I am ready. Okay, so I'm gonna go ahead and put these ones on. And if these rip or don't fit, then I'll go ahead and put the ones in there on. maybe I'll put this on the side for now. Okay. Okay. All right, so now I'm gonna go ahead and touch in here. Grab this. Okay. Shiny side down. Okay. Go in here and put it in. Okay, so I can use these if I need them for later. Okay. All right, this is gonna go right over here, right there. Okay, so now I can go ahead and position this and touch in here wherever I need to. Have my iodine. And this came already opened. Put that on the side because I might need it later. Okay, and then take this, some my lube. I'm gonna get this ready in here. Put in the lube. Okay. Okay, so now I can go ahead and grab my iodine, making sure everything is in position. So I can grab my iodine. Okay, they're well saturated with iodine, so I'm gonna go ahead and toss this. Okay, so now I am ready to go ahead and get this hand contaminated here so that I don't have to worry about everything. So this is hooked up here. The catheter part is in the lube. So now I am ready to clean. And then I'm just gonna move just a little bit this way. Okay. I'm gonna move this just a little bit this way. There you go. Okay. I'm gonna hold this so I can see the labia here. Okay. I'm gonna go outer. Towards me. And one going down the middle. Okay, so I'm done with that. Okay, so now I can go ahead and grab this here. Okay, go ahead and take a deep breath for me, okay? Okay, 1, 2, and 3. Slowly going in, letting go, about 2 to 3 inches. Okay, once I start seeing urine, okay, so I see urine, so I'm gonna go ahead and grab it this one, hold it in place with that hand, and I'm gonna go reach over here and slowly inflate the balloon. Okay, once it's inflated, I'm gonna go ahead and hold it taut. Okay, and I'm pulling here, making sure that it is set. Okay, so I'm gonna go ahead and take this one off. Okay, so I'm gonna let go. And I have iodine in my hand, so I'm gonna go ahead and remove this glove. And put clean gloves on. Okay. Making sure they're dry. Okay. So now I'm gonna go ahead and push this back a little for me. And then I'm going to go ahead and take this out of the catheter bag. Slowly unraveling it, getting ready to put tape on it, making sure that it's unfolded here. Okay, so I'm gonna go ahead and hook it down here. Make sure it's below. Okay, so I'm gonna grab some tape and I'm gonna go ahead and put this on the back of the leg. Okay. Gotta go, this thing likes to move here. Oh, it doesn't want to go very well. That's fine. I can move it just a little bit this way. There you go. Okay. Okay, once that's secured, I can go ahead and move all these things away. So this has my label on it. Okay, my biohazard items go in the biohazard bag. Okay, so now that it's secure, I'm going to do some hand hygiene over time, making sure that urine is flowing pretty good and it is well secured. Okay, and then I would go ahead and cover her up and make sure the bed's at the lowest position, and I would clean this up. But I'm gonna go ahead and come back in and we're gonna go ahead and get a sterile sample. Okay, so uncovered her, making sure I double check my orders, and I'm gonna go ahead and get my sterile sample, making sure I double checked the physician's orders. So I'm gonna get my 10 milliliter. Okay, and then, okay, so my 10 milliliter and some sterile wipes here. Okay, so I'm gonna go ahead and move this, pretend this is out of the way. And then this, I would come back in with the sterile container. Okay, so now I have this, my sterile container that I have here. So I'm gonna go ahead and make sure all the urine is low in the catheter. Okay. All right, I'm gonna go ahead and kink the catheter. So that I can catch some fresh urine. Okay, so the catheter is kinked. Okay, so I'm gonna go ahead and clean that port there, and I'm gonna have some gloves. Why not? Hand hygiene. Okay, by now some fresh urine should have accumulated. Okay. I'm gonna wipe for 15 seconds. Right, 10 and 15. Awesome. Okay, I'm gonna throw that away. We don't need that anymore. I'm gonna go ahead and make sure this is sterile, still not open and up to date. So we're gonna use this. Awesome. Making sure the tip is still sterile. I'm gonna come over here. Fresh urine has accumulated, so I'm gonna go ahead and put that in here. Okay, so I'm gonna go ahead and get as much as I need for the specific lab that I'm gonna be testing for. So we'll say we'll get 10 cc's. Okay, I'm gonna go ahead and unhook this, making sure that nothing touches it and my sterile container is open. I'm not gonna put this in there. I'm gonna go slowly pushing this in, all the way in, slowly. Okay, once that's in, I'm gonna go ahead and throw this away. And we're gonna go ahead and close this off. Okay, once this is secure and closed and it's still sterile, we're gonna go ahead and put our, okay, put this here. All right, so this is our, if I can get it open. Okay, so I'm gonna write the patient's name, date of birth, date, time, the specific lab we're doing, where the urine catches, my initials, the nurse that got the specimen, and my signature. Okay, so everything's in there now, and we're gonna go ahead and send this off to lab in a biohazard bag that I'd have, and making sure that it's still sterile and everything's good. Okay, so now that's over with. Okay, take my gloves off. Okay. All right, hand hygiene one more time, because now we come back in and the doctor ordered the catheter to get taken out, so that's what we're gonna do. And I'm gonna make sure that that's unkinked before I do anything after the test. All right, so now I'm gonna grab my 10 millimeter. Okay, and a hand towel. Okay, so I'm gonna go over here and put the hand towel right about there. Okay. All right, so we're gonna go and hook that down there, and I'm gonna go and untape this. Well, first I'm gonna remove the water, the bubble from in there. Okay. Okay, so I'm gonna go ahead and aspirate for the first time, and then let it, all the water slowly disinflate, and the water's gonna go back in here. And the reason for that is because if it wrinkles, if I push it really fast and it starts wrinkling, then the wrinkles when I pull out the catheter could harm or cause some pain to the patient, and we don't want that. But for time purposes, we're gonna go ahead and say that happened, and I waited all the time. And okay, all 10 of the previous 10 milliliters are now out. So now I can go ahead and remove that, throw this away. Okay, so now I'm gonna take this out right here and then grab this here. All right, Sue Quinn, I'm gonna go ahead and remove your catheter, okay? Can you go ahead and take a deep breath for me? Okay, 1, 2, and 3. Awesome, very good job. Okay, so now I'm gonna go over here, making sure it's sterile here. All right, well this one's really full, but there we go, awesome. It's really full, but it'll work. Okay, so then I'm gonna go ahead and remove my gloves. Come over here, and I'm gonna do hand hygiene. Okay. All right, hand hygiene, dry. I'm gonna go ahead and give her privacy. Fold her legs. Go ahead and put your legs down for me. Awesome. Okay. And put this back up here. And lower her bed. And I'm gonna go ahead and clean up and document that the catheter was taken out. And while I document if there's any pain or any bleeding or anything that I would be aware of. Okay, so I'm gonna clean this up and then we'll be done.